Hello, welcome all. Myself Dr. N. Srikanth, interventional cardiologist practicing at CVR Hospital, Guntur, Samsepet. Yeah, today we will deal with some questionnaire related to heart and heart related problems. First of all, how do you define a healthy heart? So, objectively, this is actually a subjective question. So, healthy heart is one which doesn't have any symptoms to the patient. I mean, if the person doesn't have any symptoms related to heart, that is chest pain, breathlessness, and etc. like that. If doesn't feel any symptoms like that even during exercise, then you can say that the person is having a healthy heart. But again, as I said earlier, it is purely subjective, because some patients may feel that they are not having any chest pain, not having any breathlessness even after walking for 10 kilometers or like that. So, taking into that consideration, if you want any objective definition, means if the person is having no symptoms related to heart like chest pain or breathlessness, and if the same person is having normal ECG, normal echocardiogram, that means a scan related to heart, and even there is no changes during treadmill test, that is, we will make the patient or person to walk on a treadmill, and we will record the ECG changes, blood pressure changes, heart rate changes, and like that. If that test is negative, we can confidently say it as the patient is having a healthy heart. So the second question comes to what is meant by a heart attack and why someone gets a heart attack. That means heart attack is a layman term for a decreased blood supply to the heart. For example, this is the anatomy of the heart, and we have three coronary vessels supplying the heart, vessels supplying the heart. If any vessel gets blocked, we will get, blocked means 100% occluded, we will get a heart attack. So if you want to say theoretically in a diagrammatic picture, this is the normal blood vessel. Usually think that this is normal blood vessel, blood flow through the column, and this is the sclerotic blood vessel. That means if the patient is having symptoms, this is a plaque, coronary cholesterol plaque, which is occluding the flow of the blood. At this stage, patient may have chest pain during walking, chest pain while climbing stairs, or chest pain during lifting heavy weights like that, or even sometimes breathlessness. For that matter, diabetic people may not experience any chest pain. So for those people, you may have considered that even breathlessness should be considered as a angina equivalent, which is related to heart. So at this stage, what happens is the coronary atherosclerotic plaque ruptured, and which causes the 100% occluded of this dotted line represents the blood clot. So this dotted line represents the blood clot. This is the plaque and this is the clot. So this clot causes the 100% occlusion of the vessel. So related when a coronary blood vessel is 100% blocked, patient gets heart attack. That means patient gets heart pain. So why someone gets a heart attack means because of his lifestyle, because of his age, because of his many risk factors. Risk factors like people who are diabetic, people who are hypertensive, people who do smoke, people who excessively consume alcohol. These are the people at risk. Even a normal person, if they may suffer sometimes without all these risk factors, that is, if the person is not smoker, non-alcoholic, non-hypertensive, non-diabetic also, they may experience heart attack because of his age. But even young people are now suffering from heart attacks, which should be kept in mind. So the third question is, does all the chest pain is related to heart attack, or how can we differentiate? I would put this question in a different manner, that you have to consider any chest pain above the upper abdomen to the jaw, that means neck. You have to consider that pain as cardiac, unless if you rule out the cardiac, anything problem, any other chest pain, you may slowly you can differentiate by time also. Because if you cause delay in the diagnosis of chest pain related to heart, it may kill a patient also. So if you consider chest pain a central chest pain, which is associated, that means which is coincidental with sweatings, palpitation, that means increased heartbeat, and breathlessness is related to heart, that is related to especially related to heart attack. Sometimes patient may experience chest pain which is radiating, which is transmitting towards jaw, towards left shoulder, towards sometimes right shoulder, sometimes left hand also. So that is a cardiac pain, that is a chest pain. In those circumstances, one should not wait at a house or at a thinking that it is a non-cardiac, thinking that it might be a gas related problem. So you should not wait at the house, and you have to rush to a cardiologist, and you have to take consult or a physician. So this is how you can differentiate between a heart attack and non-cardiac chest pain. So the fourth question is is heart attack is the only problem of heart, or then any other diseases of the heart? Heart attack is a disease of the, as I said earlier, as a disease of the coronary blood vessels, that is the blood vessels of the heart. You can have diseases related to the muscle, cardiac muscle, or you can have diseases related to the pericardium, that is the covering of the heart. You can have diseases related to the valves, that is inside the heart you have 4 valves dividing the chambers. So and you can have diseases in children. You can have diseases related to birth defects, that is you may have, the children may have some hole in the heart, like that, some of the heart related diseases. So the fifth question is, sometimes even a healthy person can experience a heart attack. Is it possible? Yes. Answer is, it is definitely possible. Even a healthy person can experience heart attack. That can be attributed to his habits, that is smoking, excessive consumption of alcohol, or even kidney chewers, like that, even normal hypertensive, diabetics, like that. If these patients if these persons are having these risk factors, we will definitely advise them to undergo periodical checkups. Okay, or even if the patient doesn't have any of these symptoms, if any of these risk factors, if the person is experiencing breathlessness while climbing stairs, or breathlessness while doing heavy exercise, one should undergo some preventive examination at least once in a year. Okay. Then sixth question, is it possible for a person to live a normal life after getting heart attack? Of course. Once heart attack means, if you can identify at an earlier stage, we have a window period of 12 hours. But if you come as early as possible after heart attack, the chances of getting a successful normal life will be very much higher. That means if you come within 1 hour after heart attack, you can be absolutely normal after 1 month. So if you come after 12 hours of the heart attack, you may not be normal after 1 month, because you will have some problems and you should have to restrict your life activities, like that. So once successful treatment happens, that is within 1 month, within 1 hour, either by giving thrombolytics or either by doing primary PCI, most of the patients can lead normal life. At least they cannot be dependent on others. But once treatment is delayed, or because of the ignorance of the patient, or because of the non-availability of the doctors, particularly in villages, or because of any other financial reasons or any other reasons, patients may not experience normal life after the heart attack. So that is why I advise to undergo a periodical regular checkup persons having risk factors. That is, as I said earlier, those who are hypertensive, those who are diabetics, and those who smoke, those who do take alcohol excessively, like those who has a family history of heart attacks. That is, if a male, if a person, or if a woman having heart attacks at an early age, that is before 50 years, their kids are likely to get heart attacks also. So for those people, I would definitely advise to undergo periodical checkups after 40 years. So the final question is, how do you live a healthy heart life and saving a very fit, like this means there are some preventive measures to keep yourself healthy and to keep your heart healthy. So first one is that you have to do regular exercise. Exercise means just walking, or just brisk walk is enough. At least daily 20 minutes, at least 5 times a week is enough. And you have to modify your risk factor. That is, you should not smoke, and you should not drink excessively, and you should eat a healthy diet also. That means vegetables are good, and less of carbohydrates, and less of saturated fats, less of vanaspati ghee, and less of sweets which are made of ghee, etc., and less of energy drinks like cool drinks, like cola drinks, like many like that, and less of red meat. Red meat is definitely not good for heart. White meat, that is freshwater fish, and even chicken is good for heart. Red meat is avoided, so far concerned to the heart, it should be avoided. Okay, and getting a periodical checkup is also mandatory for those patients who are having risk factors, and for those patients who has some family related heart problems. So to conclude, one should stay fit to keep his heart fit and healthy. Thank you.